Hello and welcome back. This is Dr. Mridula here. So a lot of my patients who come for difficulty in seeing far or near objects, I evaluate them and then I finally give them their glass powers. So in that, when they look at the prescription, they see something as a spherical power and a cylindrical power. So a common question that they ask me is, Doctor, what is the spherical power? What is the cylindrical power? Are they the same? Will it increase? Will it decrease? So I thought I'll share it with you today. So first, coming on to the spherical power. Now this spherical power, it can vary. Okay, so now it is mainly based on the size of your eyeball, right? So there are chances that the power will keep varying, and by around 18 to 20 years it will remain constant. In patients with the spherical power, the curvature of the cornea, everything else is absolutely normal. It's just that the light rays don't focus exactly on the retina. The light rays either focus in front of the retina or behind the retina. So we give them correction such that the light rays focus exactly on the retina. So it can either be a myopic or a hypermetropic. Myopic are those individuals who can see near things very clearly, but they will require power or glasses to see far things better. Hypermetropic are individuals where they can see far things very clearly, but they will require a plus power to see near things better. So I've seen many of my patients, especially when that age between 13 to 14 years, when they have that growth spurt, there will be a sudden increase even in their glass power also, especially the myopic power, the myopic spherical power. There is a rapid increase in this power. So it is quite common. A lot of parents panic because of that, but it is quite common to have this sudden increase in the power, especially during the growth spurt. Now, individuals with a spherical power, what happens is, if you place an object, they will not be able to see that object clearly. There will not be any glaring or shadowing of the object, which you tend to see if you have a cylindrical power. In a spherical power correction, you will just not be able to see that object clearly. Once you wear your glasses with a proper spherical correction, those images will be crystal clear. So next, coming on to the cylindrical power. Now this is completely different from a spherical power. In cylindrical power, it is mainly based on the shape of the cornea. So normally, the cornea should be uniformly shaped. It is uniformly circular, rounded. Okay, so imagine that if you take a basketball, so it is uniformly shaped, right? So in any direction if you change, the curvature remains the same. But in case if you take a rugby ball or imagine an egg, it is slightly elongated in one direction and slightly less curved in the other direction. So individuals who have a cylindrical power, what we also called as astigmatism, the curvature of the cornea is such that it is slightly elongated in one direction and less curved in the other direction. So these individuals will require a cylindrical power in order to correct it. And also an axis. So basically the orientation of the curvature will be corrected based on the axis, whether it is curved along the 180 direction or the 90 direction. Accordingly, we will have to put cylindrical lenses in that direction. And then, so in most of the individuals, the cylindrical power tends to remain constant. It doesn't fluctuate so much. It will certainly not reduce, but it will not fluctuate so much like in case of a spherical power. But in case if we notice that there is a variation in the cylindrical power very frequently, then it is important to do a scan called as a topography, wherein it will properly analyze the curvature of the cornea. This is done in order to avoid a condition which is called as keratoconus. That is where the cornea, instead of becoming proper like this, it becomes more like a conical type. Kerato means cornea and conus means like a conical type. So in order to avoid that condition where it reaches to a high degree keratoconus, it is important to evaluate the patient every 6 months to 1 year and see if the cylindrical power is constantly progressing. Now in case if the patient reaches a stage of keratoconus, it can be corrected with surgical methods. Another thing is a patient with a cylindrical power. So if you place an object, they will be able to see that object, but there will be a little bit of glaring of the object, or it might appear slightly elongated in one direction, either horizontally or vertically, or there will be a little bit of a shadowing. So the individual either will have to tilt his head or squint his eyes in order to see the image clearly, and this can actually cause a lot of headache. So patients with complaining severe headache might also have more of a cylindrical power than a spherical power. So I hope I've made it very clear to you the difference between a spherical power and a cylindrical power.